All right, let's dive into a fear that is incredibly common but can feel super isolating when you're the one experiencing it: the fear of needles. For a lot of people, this isn't just a little bit of anxiety. No, it's a huge, overwhelming response. So let's really get into what's going on behind this phobia.
Seriously, have you ever felt that? That sudden, heart-pounding jolt of panic? That feeling like you just have to get out of there? All from just seeing a needle, or maybe even just thinking about one? If that sounds familiar, you are definitely not alone. It's a really intense physical and emotional reaction that can feel totally out of your control.
And you know, that intense feeling, it's not you being dramatic or just squeamish. No way. It's a real, recognized condition. It actually has a formal name, and just knowing that gives it a kind of legitimacy, which is so important for understanding it and eventually learning how to manage it.
And that name is Belonephobia. So what is it? It's defined as an intense and, irrational fear of needles, injections, and really any other sharp medical objects. What's wild is that the fear isn't just about the poke itself. It could be triggered by simply thinking about a needle. So, you might be wondering, where does a fear this powerful even come from? It almost never just appears out of thin air. Like a lot of phobias, Belonephobia usually has some real, tangible roots in our past experiences. Let's dig into what those are. Okay, so there are a few usual suspects here. For some, it all stems from a really painful or scary medical event. You know, maybe an injection that went badly or really tough blood draw. For other people, it's actually tied into a bigger fear of injury or blood in general. A traumatic medical procedure when you were a kid can be especially powerful, kind of cementing that fear really early on. And sometimes it's connected to an underlying anxiety disorder, which just amplifies these specific fears. Any of these can create this vicious cycle. A bad experience creates fear, that fear makes you avoid it, and that avoidance just makes the fear even stronger for next time.
And this is such a critical point to really let sink in. Having this fear is not a sign of weakness. It's not a personal failing. It is a recognized, diagnosable condition. Your feelings are completely valid, and just understanding that is the huge first step toward doing something about them.
Now let's talk about why this matters so much. Because Belonephobia isn't just about a few terrifying minutes in a doctor's office. It has this serious ripple effect that can impact a person's entire life and, most importantly, their health. So you see, the phobia really creates two different kinds of problems. On one hand, you've got those immediate physical reactions, that strong anxiety, the dizziness, maybe even fainting. But on the other hand, the long-term impact is honestly even more serious. This fear leads people to avoid injections, skip essential vaccinations, and put off necessary medical treatments. It literally becomes a barrier to their own health. And this right here is the absolute heart of the problem. The fear directly interferes with getting medical care. It's not just some harmless quirk, it's a condition with really serious long-term consequences because it stops people from getting the care they need to stay healthy. But here's the good news. And it's really good news. This is not a life sentence. There is a clear path forward. There are real ways to regain control and learn to manage this overwhelming fear. Treatment usually follows a pretty manageable step-by-step path. So, step one is often therapy. Things like cognitive behavioral therapy, or CBT, help you change your thought patterns around the fear. Then there's exposure therapy, which gradually and safely reintroduces you to the thing you're afraid of to lessen your reaction over time. Step two is all about coping techniques, stuff like deep breathing, relaxation strategies, things you can do to manage the anxiety right in that moment. And for really severe cases, medication can be an option to help control the panic. And the biggest takeaway here is one of hope. This isn't just a theory. This stuff works. With the right treatment and support, so many people successfully reduce their fear. They get to a place where they can receive the medical care they need, not just without terror, but actually comfortably. So we'll end on this thought. Instead of just thinking about overcoming a fear, try to reframe it. What could managing this fear truly unlock for you? What doors to better health, to preventative care, to just peace of mind could it open? Because it's about so much more than just beating a phobia. It's about reclaiming a vital part of your own well-being.